Hi, you guys. Welcome back for our daily practice questions. It is day 74. And as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. All right, you guys, if you're looking to join my upcoming 5 week intensive review, I have 2 spots remaining. Click the link to join the course if you are looking to enroll for the April 21st through May 30th course. All right, question number one. A 25-year-old woman presents to your clinic complaining of frequent headaches. She describes the headaches as a mild to moderate dull pain that is bilateral and feels like a tight band around her head. The pain tends to last for several hours and is not associated with nausea, vomiting, or photophobia. She reports that the headaches occur several times a week, especially after long hours at her desk or when stressed. Based on her symptoms, what is the most likely diagnosis? Is it A, migraines, B, cluster headache, C, tension headache, or D, a sinus headache? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question states, based on her symptoms, what is the most likely diagnosis? And y'all know what I always say. If they're looking for a diagnosis, you need to run it back and look at those assessment findings. And look and see how they present. What are their signs and symptoms? What is the chief complaint? What is noted on exam, right? So this 25-year-old woman comes into the clinic complaining of frequent headaches. She has headaches that she describes being mild to moderate. Dull pain is bilateral and it feels like a tight band around her head. Y'all, this is classic. And you know my saying when those key identifiers are presented, when I say this, you say that. So when I say band like headaches, you say tension every time. No questions asked every time. C is your best answer, tension headache, okay? Question number two. A 30-year-old man presents to your clinic with a history of occasional tension type headaches. He describes his headaches as bilateral with a mild to moderate intensity and typically occurring after a long day at work. He prefers non prescription treatments, but finds that over the counter medications like ibuprofen and acetaminophen only provide partial relief. What is the next step in treating his acute tension type headaches? Is it A, to prescribe sumatriptan for acute treatment? B, recommend physical therapy and stress management techniques? C, prescribe a higher dose of ibuprofen for better pain control? Or D, recommend a combination of acetaminophen, caffeine, and aspirin like in Excedrin? Take a moment and tell me what you got. Tell me what you got. All right, so stem of the question here. What is the next step in treating his acute tension type headaches? All right, so the stem is telling you what the diagnosis is, and we're trying to see what the next steps are in treating these tension type headaches. And so he's already tried over the counter medications like ibuprofen and Tylenol, but he's only getting partial relief. So in scenarios like this, it's best to give the medication that has all of these combined. You know, your aspirin, your acetaminophen, and a caffeine component like your Excedrins. These are often like, especially for people who prefer to get things over the counter versus more of a prescription medication. So pay attention to the wording of that. If you're looking for something over the counter that's on the stronger scale, that Excedrin, because of it having the three components, often is a good choice for them. So in scenarios like this, that's the next choice that you should go with because he's already tried the ibuprofen, the Tylenol, not getting long-term relief. So let's pack it with all three. And then lastly, question number 3. A 42-year-old woman has been experiencing frequent tension type headaches occurring 3 to 4 times per week. They are typically mild to moderate and are not significantly relieved by over the counter medications. She reports significant stress due to her demanding job. What is the most appropriate prophylactic therapy for her tension type headaches? Is it A, amitriptyline, B, sumatriptan, C, topiramate, or D, propranolol? Take a moment and tell me what you got, y'all. All right, so stem of the question here states, what is the most appropriate prophylactic therapy for her tension type headache? So here now we're looking for prophylactic therapy, right? For this tension style headache. And the best answer choice here is A, amitriptyline, aka Elavil. Elavil is often utilized as prophylactic management. It can also be used for prophylactic management for migraines, but it's commonly utilized for prophylactic management for tension type headaches. Okay. Remember sumatriptan, you can rule that out. That's acute therapy for migraines. Topiramate and propranolol are utilized for prophylactic therapy for migraines and not for tension headaches. Okay, so A is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And as always, if you're looking to book any of my one-on-one sessions, any of my question analysis sessions, or any of my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.